Hey, so today I want to talk a little bit about herniated discs and a treatment protocol that we started here back in January, and it's been fantastic. Our patients love it. It's called decompression. Decompression is a way to reduce herniated discs. As a matter of fact, we've had people who were scheduled for surgery use this treatment protocol and avoid surgery altogether. So this is a fantastic treatment option for those of you with sciatic pain, herniated discs, back pain, and those type of back problems. The back, if you look here, you can see inside the spine we have the discs in between each of the vertebrae. L4 and L5 are the primary ones that go in our low back. But there's ligaments, tendons, cartilage, and soft tissue down there that gets it's like scar tissue forms. Now, part of the problem with the discs is that there are muscles that guard against us stretching the disc and opening the space. In other words, if we were able to open the space, we would be able to get the disc to behave and act better and take pressure off the nerve and reduce our pain, obviously. The problem is, though, we have these muscle spindle fibers, and inside the spindle fibers of the muscle, if we can look under a microscope, there are these little on-off switches called Golgi tendon organs, and their purpose is to protect us. So if we stretch something too fast, the Golgi tendon organs switch on and contract our muscles. So if you're doing inversion on an inversion board or some kind of manual traction, you would have to fatigue the muscle, which is a long process in order to get decompression or traction to work. A unit like this is our ErgoFlex back on track decompression unit, tricks the Golgi tendon organs and helps them to relax. And it does so with intermittent axial traction, which means it pulls and then relaxes and pulls and relaxes. So it tricks the Golgi tendon organs into thinking that everything's cool and the muscle bundle fibers don't contract and don't react. So we get right down deeply into the ligament, tendon, and cartilage tissue, the soft tissue, to stretch it out so we can open space and allow the disc to go back where it belongs. So we're going to use Janet as our patient, and Janet's going to get on the unit and we're going to describe how it works, and we're going to show you how it works. So she's going to get on, she's going to put her arms over the arm bolsters, and we're going to set this up for her. We're going to set it up for about 12 minutes is what we usually do, and we're going to do a 3.5 inch traction. You'll see the table separate when we get it set up, and what I'm going to do is I'm going to show you a axial traction and intermittent traction unit setup with flexion to the right and left at 20 degrees. So Janet, hold that for a second. And what I'm going to do is just have her bend her knees flat, and we're going to just strap the knees down. This is a very simple unit to use and operate, but it's very effective. And go ahead and lay back, and we're going to start this process. So we go from a seated position to a completely supine position, taking pressure off the back completely. And we also have, if you look on the control panel here, the little controller, we have vibration for upper and lower back. We have heat as well. And sometimes we like to put all three on. So we're going to do that for Janet right now. We're at 3.5 inches of traction. Now watch the table as it separates. It's going to separate and open space for her back. You see how the table separates. It's going to pull and stretch her. And what's really cool about the setting I have on for her right now is it's going to reset. So it resets a little bit, which again tricks those muscle bundles to relax. So we don't have to fatigue the muscle. We could get a much better and effective treatment in a much shorter duration of time. But watch what happens now. The table's going to laterally flex 20 degrees. So let's say she's got sciatic going down her right leg. Typically we want to flex her to the opposite side, and we open this space. You feel how it stretches this side? And then it's going to do the same thing. It's going to back off a 1/2 inch, and then it's going to come back again, tricking those on-off switches, the Golgi tendon organs, to not allow them to really react and contract. So it stretches her out, and then it'll contract again, it come back to neutral position, do the same thing, and then it's going to come and swing to the left, and it's going to stretch the right side sciatic nerve and the right side disc. So a lot of times discs, when they come out, if you guys have ever had a disc herniation or sciatica, it's usually just one side, or one side is worse than the other. And that's what we typically do. We'll set it up so that it'll flex away from the side of pain and open that space. And so when you do that, you really get a nice opening of the nerve hole. If you see what I'm doing here, as I laterally flex, you see how that opens up on the model? And that's exactly what happens inside the body. So this has been a very effective, very, very important part of our adjustment protocol and our treatment protocol for herniated discs. So if you know anybody who's got a herniated disc, or you yourself has suffered with herniated discs, low back pain, or sciatic, give us a call. This unit and the chiropractic adjustment will help you immensely. So remember, stay informed and get adjusted.